In this video, we will examine the difference between observational study and an experiment. In an observational study, the researchers would observe and record the information from the individual only. The researchers do not interfere. In an experiment, the researchers would assign some sort of treatments or methods to the individuals in the study. In this case, the researchers would interfere. Both of the samples for the observational study or the experiment comes from the population. There are values of the explanatory variable for either observational study or experiment. In an observational study, the value of the explanatory variable are chosen by the individual. The individual decide or choose which method in the explanatory variable. We call this self-assigned because the individual, the subjects in the study, assigned the methods themselves. In an experiment, these values of the explanatory variable are assigned to the individuals by the researchers. So the researchers control the explanatory variable in an experiment. If we want to know if a treatment is effective, then experiment is the only way to go. For example, let's just say we want to know whether the drug melatonin is effective in making people fall asleep quickly. In an observational study, we would simply do a survey and ask people whether they take the melatonin or not. They would answer either yes or no. That is the methods, either taking the drug or not taking the drug. They choose the method, they choose the treatment, whether they get the treatment or not. The researcher would then record these self-assigned methods. The methods is whether they take the melatonin or not. Then the researchers would record whether the individual had a good night's sleep or not. Notice that the researchers do not interfere. The researchers do not tell the individuals in an observational study whether they should take the melatonin or not. In an experiment, though, the researcher would assign two groups. One, perhaps they will give the real drug, in this case, the melatonin. In another group, they will give them the placebo. The placebo is a fake treatment. In this case, it is a sugar pill. It is called the fake pill because it does not have the chemical of the real medicine. Even though it is a fake pill, it is still considered as a treatment because the individual do not know whether they take the melatonin or the placebo. Although the individual are aware that they are going to take a pill, but they are not aware whether it is a fake pill or the real drug. In this case, the researchers clearly assigned which method, which treatment to the individuals, and so this is an experiment.